Hello everyone and welcome. We will be learning about the basics of breast cancer and possible ways to lower our chances of getting cancer. So, let's begin. So, what is breast cancer? Breast cancer is the uncontrolled growth of cells from breast tissues. As cancer cells divide, they tend to group and clump together to form tumors. Tumors can spread to surrounding tissues or other areas of the body. While the disease occurs more in women, it can at times occur in men. Among women, breast cancer is the most common type of cancer and the second most common cause of cancer death after lung cancer. A risk factor is anything that affects your chances of getting breast cancer. Some factors you cannot change, such as being a woman, your age, or your family's health history. One of the main risk factors for breast cancer is simply by being a woman. Older age. As we get older, our chances of developing breast cancer also increases. Most invasive breast cancers occur in women ages 55 or older. If you have a personal or family history of breast cancer, your risk increases. Some breast cancer cases are thought to be caused by a gene defect that is passed down from a parent. If you have your first period before the age of 12 and reach menopause after the age of 55, you are slightly higher in risk than women who have a shorter lifetime of menstrual periods. Some women's mammogram exams may find that they have dense breasts. Having dense breasts means you have more breast tissue than fatty tissue. While it is common to have dense breasts, it can increase your risk for breast cancer. Other factors are related to personal behaviors or lifestyle, such as how much alcohol you drink or your body weight. Alcohol use can increase the chances of breast cancer. Having more than one drink a day has many serious health risks if you are a woman, including raising your chances of developing breast cancer. Being overweight or obese can increase breast cancer risk, especially after menopause. Childbearing may affect breast cancer risk. Not having children at all or having your first child after the age of 35 is sometimes linked to a slight increase in breast cancer risk. Also, using certain types of hormone therapy to treat menopause symptoms may increase your risk for breast cancer very slightly. What can you do to reduce your chances of breast cancer? First, if you are pregnant or thinking about getting pregnant, consider breastfeeding after you deliver. Breastfeeding may slightly lower breast cancer risk, especially if it is continued for 1.5 to 2 years. Second, if you drink alcohol, cut back on the amount you drink. Studies show that your chances of getting breast cancer increases each time you drink alcohol. Other ways to lower your chances include maintaining a healthy body weight, especially after menopause, and exercising on a daily basis. Being physically active can be both fun and helpful. Lastly, decrease your daily fat intake and increase the amount of fiber you eat. So, eat more fresh fruits and vegetables. Now you have a general overview of some risk factors related to breast cancer. While there are risk factors that you cannot change, there are ways to help find cancer at an early stage so you can get treatment that may save your life. Detecting breast cancer at an early stage can increase the treatment options and save lives. Treatment is more likely to be successful when the tumor is small. Annual checkups are encouraged. It's a good habit to get into. Your doctor may perform a clinical breast exam as part of your routine screening. However, mammograms are the most commonly recommended screening method for breast cancer. Women ages 40 and older should make sure they have a discussion with their doctor about when to begin screening, how often they should get screened, and what type of screening is best. Following your doctor's screening recommendations can improve the chances that breast cancer will be found at an early stage and treated successfully. So what are mammograms? A mammogram is an X-ray of the breast. It can be used to detect possible breast diseases in women who appear to have no symptoms at all. Mammograms are the most effective screening tool today for detecting breast cancer early. Before you schedule a mammogram screening, you should tell your provider about any changes in your breasts. Inform your provider if you have any family or personal history of breast cancer. The best time to make your mammogram appointment is 1 week after your period has ended or when your breasts are not tender. What are the do's and don'ts on the day of my mammogram screening? First of all, do not wear deodorant, baby powder, or lotion under your arms. This may interfere with the exam and lead to inaccurate results. When available, bring any previous mammogram pictures or results with you to your radiologist if the mammogram was done at a different facility. At the end of your screening, ask when you will get your results. What will happen to me during the exam? Once you enter the exam room, you will be asked to undress from the waist up. Depending on the machine, you may be asked to sit or stand. Each breast is then placed one at a time on a flat surface that contains the X-ray plate. A device will gently press against the breast. X-ray imaging will then be taken at various angles. You may have to hold your breath while the image is being captured. Mammograms can be mildly uncomfortable as it is necessary to press the breast during the procedure. However, pressing on the breasts assures that you get the least amount of X-ray needed to get a proper image. The discomfort lasts only a short time and the entire procedure usually takes about 20 minutes. Some women have dense breasts, which will show on their mammograms. Having dense breasts means you have more breast tissue than fatty tissue. This is common among women, especially Asian American women. In New York State, radiologists are required to inform you on your mammogram report if you have dense breasts. So, why is it important to know if you have dense breasts? Dense breasts can make it harder to see cancer on a mammogram. Having dense breasts also increases your chances of developing breast cancer. But keep in mind that it is not the only factor. A combination of factors such as age, genetics, personal or family history of breast cancer, and lifestyle choices also affect your chances of developing breast cancer. If your mammogram finds you have dense breasts, first talk with your doctor about your results and any other risk factors you may have to see what this means for you. Your doctor may recommend more testing, such as a breast sonogram. For women ages 40 or older, yearly mammograms are still the best way to detect breast cancer early. Many people are concerned about the exposure to X-rays when receiving a mammogram, but mammograms require very small amounts of radiation. The risk of harm from this radiation is very low. However, the benefits of getting regular mammograms are nearly always greater than any harm that can come from radiation exposure. A few years ago, Miss Lee, who was then in her 60s, had her routine mammogram. A mammogram is an X-ray of the breast which is used to detect breast cancer or other breast diseases. She did not have any symptoms or feel any lumps in her breast. However, the mammogram result showed an abnormality in her breast and her doctor recommended further testing. She went to get an ultrasound and a biopsy, which showed she had breast cancer. Miss Lee had surgery to remove her breast and began treatment right away. Because she acted quickly, Miss Lee was able to make a full recovery. Like in Miss Lee's case, breast cancer often does not have any outward signs or symptoms, especially in the early stages. That's why mammograms are so important in detecting cancer. These recommended exams and screenings give women a better chance at finding and treating cancer early. Now, let's talk about some important warning signals to look for. If you have any of the following breast changes, consider speaking to a doctor. Lumps of any size or thickening inside the breast. Swelling, warmth, redness, or darkening of the breast. Any changes to the shape or size of the breast. Skin points inwards. Pain on the nipple. Nipple changes from pointing outward to pointing inward. Changes in the nipple can be a sign of cancer. Some women normally have nipples that point inward, which is not a sign of cancer. Nipple discharge or bleeding. Pain in one part of the breast that will not go away. Lastly, lumps under the arms. As one breast cancer survivor said, "Know your body and be familiar with what is normal. If you notice any changes to how your breasts normally look or feel, Speak to a healthcare provider. Learning that you have breast cancer can be scary and overwhelming. Learning more about cancer and your treatment options can help. Don't be afraid to ask questions, no matter how small you might think they are. Some questions you can ask your doctor are: what kind of breast cancer do I have? What is the stage of my breast cancer and what does it mean? What type of doctors should I see? When should I see them? There are different types of treatment based on how they work and when they are used. Surgery is often the first treatment for breast cancer. The surgery may either remove the cancer lump or remove the whole breast. You have an option to construct a new breast after it is removed. Chemotherapy uses medicine to weaken and destroy cancer cells. It is often given after surgery to try to prevent the cancer from coming back. Hormone therapy treats certain breast cancers by lowering or changing how the hormone estrogen acts in the body. Radiation therapy uses high-energy particles or waves to destroy cancer cells. Complementary medicines, such as herbal medicine or acupuncture, are additional medicines that can help relieve your breast cancer symptoms and side effects from treatment. Discuss treatment options with your doctor to learn what is best for you. Coping with breast cancer is a challenge, even for the strongest person. Understanding what to expect can help you cope. After learning that you have cancer, you may feel angry, scared, stressed, or depressed. It is normal to have these feelings. Learn more about your condition and what you can do. Seek help and don't be afraid to ask for help. Talk to your doctor, who may refer you to specialists for counseling or treatment. Relieve stress through exercise and doing things you enjoy. Find support by talking to your friends and family about your feelings or attend a cancer support group. The Charles B. Wang Community Health Center holds a breast cancer support group each month. After treatment, keep seeing a doctor for regular checkups. Most people return to see their doctor every few months during the first few years after treatment. Prevent cancer from returning. Limiting how much alcohol you drink and staying at a healthy weight not only helps lower risk of cancer returning, but also with other conditions like depression or fatigue. For more information regarding breast cancer workshops and screenings, please feel free to contact us. Those with low income or no health insurance may qualify for free or low-cost screenings at the Charles B. Wang Community Health Center. So contact us. We are here for you 7 days a week.